Hi, my name is Dee Fenner, and I'm the Furlong Professor of Women's Health and the Director of Gynecology at the University of Michigan in Ann Arbor, Michigan. I'm going to speak with you about bowel control issues. This is a topic that many women find difficult to talk about, not only with their physicians, but they many times don't mention these problems with their family, their loved ones, friends, or colleagues. This is especially true about the problem of fecal incontinence or women who have accidental bowel leakage. Yet this is a fairly common problem. If we look at women across the lifespan, the average of this type of condition is about 8% for women. Certainly for younger women, those aged 20 to 30, it would be about 4% of women would have bowel accidents about once a month. But as women get older, we see that the incidence increases. And for women who get into their 6th and 7th decades of life, it may go up as high as 20%. That women will have leakage of liquid or solid stool at least once a month. And this can be a very socially debilitating problem. Women are afraid to go out, they're afraid to leave the comfort of their home because of the risk of embarrassment of having an accidental bowel leakage. Thing is, it's very important to talk about this condition with your physician and healthcare providers because there are things that we can do. Before you see your doctor or nurse practitioner or PA, it's important to think about the type of leakage you have. You may think about when you have leakage. Perhaps it can be associated with your diet, caffeine intake, certain foods, and other things that can exacerbate your symptoms. We know that other than aging, the consistency and frequency of bowel movements can be the most predictive factors that result in fecal incontinence. So if you're having 8 or 10 loose stools a day, you're certainly more likely to have an accident than if you're having one well-formed bowel movement every 2 or 3 days. So you might even think about keeping a diary before you go to your healthcare provider, and so that you can track your accidents and be able to relate that to your healthcare provider. Your healthcare provider will take your history. They'll want to know how long you've had leakage. They'll want to know if you've had any treatments, what types of medications, have you had surgery. They'll want to know about your deliveries, whether or not you had a forceps or vacuum delivery, and whether or not you can recall if you had any tears of the muscles around the vagina and the anal sphincters at the time of your delivery. There are many things that we can do to help manage your bowel leakage. Sometimes we'll have you have physical therapy to try and strengthen the muscles to enable you to get better control. Certain medications that may try to firm and reduce the frequency of bowel movements often can help women. There are some surgeries now that are available, sacral nerve stimulation and other procedures on the market that are increasing our armamentarium to help treat women with accidental bowel leakage. So don't be afraid to talk about this devastating condition with your practitioner, and hopefully we can give you a successful treatment that will enable you to resume your normal activities without the fear of leaking stool.